Okay, everyone on Dental Nachos and here on Zoom, welcome to Are You Falling Behind by Not Learning to Place Implants as a General Dentist? I did this poll on Dental Nachos today when I was at the office, Taher, and we got a lot of spicy feedback. Thrilled to be talking with you. Just to orient our audience, we've had you on Dental Nachos CE before. You guys are an awesome sponsor with the Colorado Surgical Institute. You're dressed on brand because it's behind the, what time is it in Colorado? What you got?
Yeah, just
5:30?
literally just finished up with the last patient. So yeah, 5:30, 5:37.
So I always like when people introduce themselves with where they are now and then go back. They don't have to start, I went to high school, I went to college. So tell us where you are today and then bring us back to dental school.
Okay. Yeah. So currently speaking, we just moved into our new private practice, but also couples as our educational facility. So it's 12,000 square feet. I got 18 operatories on the main floor. I got 2 conference rooms in the basement. So I got 6,000 on the main floor, 6,000 in the basement. And one conference room can hold 40 people. One can hold 60 people. I got the lab with 2 mills, 3 3D printers, multiple ovens, fully functional lab. And we do a lot of reconstructive work here. So currently all I do for the practice is surgery and sedation. My next associate, literally her first day was with me today. So she's just shadowing this week and just doing consults and showing her prosthetics. Super lucky to have her here. She has like 5-6 years experience and she just moved in from Chicago. And I don't really do general dentistry anymore. I mean, granted, if the patient's like 96 and it's complex for whatever reason, I might do a filling or crown, but I kind of hung up the handpiece in that respect, and I just do surgery for the practice. And it's really turned out to be a cool career. It's not the direction I necessarily thought it was going to be when I graduated 12 years ago, but it's really evolved into something that I enjoy a lot. I just do a lot of all on X's. I do a lot of FP1s and 3-on-6s and just different implant techniques. And then also I teach with Colorado Surgical Institute. So we teach anything from wisdom teeth to PRF, like, platelet rich fibrin, how to do the draws and how to do that in your practice, to single implants, to vertical sinus lifts with single implants, to laterals, block grafting, full arches. We got the whole digital workflow with Photogrammetry, or we teach OptiSplint, which is a non-photogrammetry route that has, you don't have to spend 40 grand to learn how to do direct to multi-unit on your full arches. And then also my brother's an anesthesiologist in
Nice.
Irvine. And so he's, on the medical side of things, but it was cool because he's my older brother. We're 11 months apart. So we actually are the same age for 2 weeks. So we're super close. And he actually wrote our anesthesia curriculum. So now we teach IV sedation. And we just ran our alpha class on IV sedation. So the coolest thing is we have the 2 conference rooms. So at our November course, we're going to do 20 arches, 14 laterals, 30 single implants. And we got one guy who signed up for some wisdom teeth also. And so the sedation guys are going to be in one room. The surgical docs are going to be in the other. They all learn respectively, and then they go upstairs and we treat the patients together. So looking at that through that avenue, it's like, the educational component really lights me up. I get to handle a lot of complex cases and complications and revisions. I just learned a lot over the years. I continue to learn from our mentors, from our students. It's just been a really fun ride. So that's kind of like
you guys embrace the nacho spirit of helping dentists learn, laugh, feel less alone, and most of all, Taher, the most important L in our dental lives, less annoyed every day in our dental lives, because it is difficult to be a dentist. And so someone who does multiple jobs now and has done multiple jobs, being in your dental office, dealing with people who don't really want to come in, putting together, running a dental practice, Taher, is like running a circus where the animals don't try to eat you, just slowly annoy you to death, I say. So you have to look for those wins. So we're talking with Dr. Taher Dhoon, amazing sponsor with Colorado Surgical Institute. We're going to dig into a number of topics here. Are you falling behind by not learning to place implants as a general dentist? We're both going to talk about that. but then I want to just share what's on the menu. My goal is to help people move forward. At the end, I'll share one of my most favorite books on helping people. And by helping people, I mean sales. I always say, if it doesn't help, it doesn't matter. Taher, be proud to share and sell help. I'll show a quick video of someone with an implant overdenture. It took me 3 years to kindly annoy Janice to get this implant overdenture because I knew it was going to help her more than it helped me. She was going to exchange money. She was going to give me money, and I was going to give her a totally new lease on life with how she felt about her smile. But when people text CSI to 215-543-6454, they're going to learn about your menu of options. So just run us through, if someone's watching for the first time, can they work on actual patients at the Colorado Surgical Institute? How do they get licenses? How do they get licensed? And what courses are on your menu coming up? We have a deal right now coming up for November, and then in the future. Tell us a little bit about that.
Okay, yeah. So yes, you do work on live patients. And you can do live patients in multiple places, right? There's courses we all know about. There's some overseas. I think what makes ours special is that it's done stateside, but then all the patients of the practice are the patients of the course. So these are all treatment plans that were written for patients who are coming through a private practice setting. And now we get referrals from other practices in the region. But at the end of the day, all these patients are restored, they're followed up, they're taken care of in the private practice. So I take everyone to the finish line. And so for the attendees who come in, we can actually send them follow-ups and videos of their patients, and they can actually see their success rates versus sometimes not being able to do the follow-up from a longitudinal perspective. When it comes to the course in November, it's getting down to the wire, because what happens is we contact the Board of Dentistry and we get you a volunteer license. And we've been doing this for years with the Colorado Board, but it takes about 2 weeks. And we're about 3 weeks out from the next course.
And there's how many seats left? Just one seat left?
I mean, technically speaking, I'd say we could fill one more operatory,
but at the end of the day, in 2 people, if 2 nachos, you could cram 2 nachos onto the plate if we have to. Interested?
You know what's interesting? If you guys were at my old place, I'd have to say, hey, I got to close it down. I don't have enough operatories. Well, now I got 18 operatories. So technically speaking, if someone would like to come, I have a list of patients that goes around the block who are looking for this service. And it's nice to help out people in the community. So if anyone reaches out, I mean, I got enough mentors, I got enough support staff.
Walk me through this. We're watching and I'm talking to you. We got people on Zoom, people on Dental Nachos Facebook. They say, I want to come in November. I'm ready to come. What is this course all about? Is this basic, medium, advanced? What's this course all about?
I would say this one's more advanced. So the November course, when you get to February and March, is going to be basic. The November course, we're doing full arches. We're doing lateral sinus lifts. We're doing bone blocks. So we get vertebral bone blocks and we fixate the bone block down to the maxillary mandible. We're doing, dermal grafts over the bone blocks. And then I have a few people doing some single implants. So for whatever reason, if you are interested in say, hey, I want to do some single implants, I'm not interested in full arch, I do have a group of docs who are doing that together, and we can have you go off with those mentors and those docs and do singles. So looking at it through that lens, I say the vast majority of the course occurring in November is going to be advanced, but I do have one group doing some more beginner to moderate implant placements.
So you got multiple options on that menu, but if we stay with the advanced, how many days is the course?
Yeah, so the course is going to run Thursday, Friday, Saturday, and it's going to be November 2nd, 3rd, and 4th. And so on Thursday, Dr. Brisky is going to do a double arch. I'm going to do a double arch. So we cast it to the TVs, and then obviously the attendees are here live, like watching us and asking questions in real time while we do our surgeries. And then we'll show the whole digital workflow. And then one of my mentors is trying to get his diplomat status at the ABOI. So I set up a couple of cases for him to document, to get his credentialing. And then day 2, our attendees are doing the cases themselves. And day 3, our attendees are doing the cases themselves as well.
So it's a real C1, and then you get to actually do one on patients. As someone I've taught at least 50, my first implant courses, I've stayed at a basic level. It's so challenging not to learn dentistry. I'm going to give you a good example here from my failed dreams there, without being able to practice. I mean, there's just limits to verbal instruction. I always say I'm here because my dream of playing professional basketball failed Taher miserably. when you grow to this size and have this speed, you got to get new dreams. But that is me taking a long range three in high school. I was second in the conference with 43 threes in 16 games. But I know my dentist people, Taher, we don't believe anybody, right? We need a bite wing of the bite wing. You may want a CBCT of the CBCT. So in case there is a senior NBA, I just want to have everyone enjoy this 20 seconds of how I'm going to leave being Dr. Nacho, founder of Dentist Job Connect and Dentistry, and play in the senior NBA.
Looks pretty clean, man. So I actually have a hoop in my alleyway, and it struck me when I was like, okay, I feel old because some of the neighborhood kids come around and we'll just shoot around, and I'm like teaching them form and all of that. And so my games of pickup games are gone, and now I just shoot in the alleyway. It's kind of like a meditative type of thing.
I like it. Yeah. See, I'm going to go, if there's a senior NBA, I'm going to be there. But in all seriousness, Maurice Cheeks was my favorite player growing up. He was a point guard, assisting people into doing better. And that's really what you're doing with dentists. You're providing them the opportunity to learn a skill set that is not covered in dental school, but really, really, really needed in what I call the real world of dentisting. So if we just pull back a little bit, and I'll share this video in a minute. If you have someone 2 years out of dental school watching this right now, on demand in person, saying, I can do bread and butter dentistry. I don't know why people call it that. The hair, no one eats bread and butter. I call it kale and quinoa dentistry. Bread and butter, is it my cheat day? Am I at a wedding? But besides the point, I can do fillings, I can do crowns. Is it necessary for me to learn surgical skills? Is it necessary for me to place some of my own implants? My answer to that is a resounding yes, to be able to offer your patients care that's relevant, to be able to offer your patients care that you enjoy doing. Tell me why someone should really dig into the Nacho plate of implants. Pull back and tell us about that.
One thing I've found over the years is, people just need to know, like, know thyself, right? If we go biblical with some of the statements, but at the end of the day, it's not for everybody. And I want to, resoundingly say, hey, doing surgery is not for everyone. If it doesn't light you up, if you're not passionate about it, that's okay. There's nothing wrong with it. But what I will say is that for those who haven't given it a chance, I would recommend that you at least have the skill set. And the reason why is it's multifactorial, right? From a clinical perspective, we're always trying to learn and get better and improve what we can do. 2, patients don't want to go see specialists. The pendulum is swinging the other direction, and patients do not want to go and see a whole bunch of people to get treatment done. They want to stay with you. And then when we get to the financial component of it, the patients don't want to have separate financial plans in 2 different offices with 2 different monthly payments. It's easier for them to finance it in-house. And then from a financial perspective for the practitioner, you can do everything, right? You can take care of their fillings and their crowns and place their implants all at the same time and provide that benefit to them. And then financially speaking, if we're looking at the macroeconomics of things, right? Like, let's say we are due for a dip in the economy. I think it's beneficial to have skill sets where you can keep, production in-house and not send it out if you choose to do that. Because right now, some people are so busy that all they want to do is your quote unquote bread and butter. And that's good, right? That's layups and free throws and 3-pointers, and everything is good. And they're doing a good job, and they're staying profitable, and they're staying busy, and that's great. The day may come where things slow down, and now you have to offer more services to keep your schedule as busy. And it would be nice to be able to place these things. And then for me, I love doing it. Like, it really has ignited my passion and my purpose when we do reconstructive stuff. Just seeing people transform and giving them back that smile and that confidence, and seeing that their spouses see that in them is really powerful stuff.
Well, I want to reinforce some things that you said that I agree with. The more a dentist can do responsibly, it's so key to learn how to do it responsibly first. So not Dr. Taher or myself is recommending you do things that you cannot do responsibly. But one of the things you shared was, I didn't know I liked surgery from dental school, Taher, because I barely got to do any extractions at Penn. And they referred everything to oral surgery. And then I went to my residency program and did a multi-year residency where I placed 150 implants over a few years time frame. So in 2009, when I was 31, this patient came in and said he needed all his teeth extracted. He had been through a lot in life, even though he had taken care of himself financially, he had taken care of himself professionally, he had not taken care of his teeth. So we did in an upper and lower fixed implant case in our office. I'd use the periodontist for some of the implants. I placed some of the implants. So when he came back during the pandemic, I said, Rick, you got to get in the chair. I'm miserable. The pandemic stinks. You're one of the highlights of my day. You came in for implant maintenance. We're doing a video to make me feel better. But what I didn't realize was I've now shown this thousands of times, because if you're watching this, what they can do at the Colorado Surgical Institute and courses that help you be able to deliver these services is make people feel like this. So I can use that video to share with other patients who are afraid to move forward, to make myself feel better. But I want to ask you something. At the end of that video, Rick said, the financial investment was worth it. I'd do it again if I had to. Many patients say, I wish I did it sooner. Have you heard that in your operatory after a case is done?
Yeah, what I will say is I've never had anyone say, I wish I waited longer.
Right.
So everybody unequivocally, as long as the outcome is advantageous and you've managed the patient expectation throughout, is so happy. And the thing is, it's the people in their lives are happy for them. Like, nobody wants to see a spouse upset. No one wants to see a grandfather ailing and in pain. So like the generational impact on this is really what I found was the most profound thing, is to have like the husband or the wife or the brother or the sister come back and report changes in, their significant other. So yeah, resoundingly 100% agree with what you were saying.
You have many testimonials in your life, like Rick. I have them. You'll see Janice's in a second. I encourage you to take videos that are 60 seconds-ish in length to share. But Taher, I want to turn the questions. Some dentists will say, I don't know if I want to invest $20,000 in learning. I went to dental school and I already invested $500,000. They say the same things to us as CE providers as our patients say to us as dentists, and I understand. But tell us why you have students like Rick that says, I'm so glad I did this. I wish I did it sooner. It was worth it. Talk to our audience about why investing 5 figures in their education is going to result in a better dentisting life, not just, with what they can produce, but more importantly, with the patients they can help.
I think a common misconception is like, once you get the degree, like the learning is done. I think once you get the degree, now it just opens the doors to kind of figure out what direction you want to go with it. And then you can decide, yeah, surgery is what I want to offer to my patients. Okay, and then you've made that decision. Then, yeah, and I was going to say something about the video playing without sound. So I had the same thing, Paul. I just didn't know if it was me, but I saw someone comment in the chat.
Oh, wow. So they were able to read it for that one, right?
I didn't hear any audio on mine.
Geez, sorry. I think it's going to be good for this one. But I'm actually glad of that happy accident. Sorry. The previous video, you were able to read the captions or no?
Yeah, they said yes.
Yeah. So that's one of the things I share with people, and I'm glad they said it for this one. Captioning your videos for testimonials is very key, because the majority of people watch videos without sound. And that's all of us in bed at night when our spouse may be asleep or our kids are asleep or your spouse is watching a show. So I'm glad someone said that, because this next video is not captioned, but captioning your videos is really key. But tell me about the students who might have been not so sure that investing was worth it, not so sure they wanted to take time off work, but now they live a totally different life after crossing paths with the Colorado Surgical Institute.
Yeah, and just to touch base on the video thing, I'm in an area that has a pretty big Hispanic population, and so we got a couple of testimonials from guys in Spanish, and I mean it was powerful. Like,
Awesome.
This guy is still like a close friend of mine after doing his case years ago, And now his wife is coming in and actually doing her treatment, and he's pushing her to do it because of how it's changed his life. And then to circle back to answering your question, um, the investment aside, I mean, yeah, it's a lot of money, no doubt. Like, drop in whatever it is into CE, whether you sign up for a $10,000 course or whether you invest $150,000 in implants over a 10-year period. What I think that people need to do is strategically plan out within a budget. And then for those of you who are practice owners, kind of like how to balance a P&L. And then for those who are not practice owners yet, it's a good exercise in just figuring out like, okay, what am I taking home? What can I allocate from a percentage to taxes? What can I allocate from a percentage for like fun, right? I want to enjoy my life. I want to, take my family on vacations. I want to buy new Jordans or whatever the case may be. And then what am I going to allocate to self-development? And then you can say, hey, I'm into Tony Robbins. Maybe this year I take those funds and I go learn how to better myself from a mental health perspective, and I get a better outlook on life. And then maybe this year I take some funds and I take it towards surgery or whatever the case may be. But from a financial perspective, that sometimes can make people feel better because now they've allocated things appropriately through like a profit first type of mentality. And for those of you who haven't read the book Profit First, you just check out the book Profit First. It's pretty explanatory, but they wrote a whole book on it. But nonetheless, like that's a way to kind of budget the finances.
I want to interject to here, and I kind of thought of it as you were talking, which is really valuable. What big purchase in your life have you been able to pay for all of it up front? Let me explain. Was anyone able to pay for all of their dental school up front, or did they have to figure out a way to finance it? Did you pay for your practice in full, Taher, with a check, or did you finance it?
No, I still got the note on it right now.
Right. When you buy a CBCT, we bought a CBCT years ago, we financed it, right? So what is interesting to me, and I really hope we can change this mindset, is investing in yourself. You're not supposed to always have the total dollars in a bank account before you do that. Whether there's some sort of financing option with CE, whether you take out some sort of loan, you don't get to the next step in anything in life if you have to pay for the entire thing up front. Homes, cars, CBCTs. Why does C for dentists seem different? When I talk to my audience, someone listening right now saying, I'll take Colorado Surgical Institute as soon as I saved up the exact amount of dollars. And I say, by the time you saved it up, you will have missed out on so many opportunities. Why do you think that is? You deal with dentists every day.
Yeah. This is interesting you bring it up. I've never actually thought about it through that lens. Yeah, I don't have the answer to that. What I would say is, though, I'm glad you bring it up because we break these out over a year. For some people, they have proceed finance that comes in at a super low interest rate and breaks it out over multiple years. For me and my CE journey, I started doing CE as soon as I graduated. I mean, like 11, 12 years ago, I started doing a whole bunch of CE, and just, my wife was super, she's a dentist as well. She was understanding of like, hey, this is like my passion. And she held down the fort while I traveled a lot and did these things. And so I think having a good partner is important in this. If you have someone, and if you're single, then hey, now's the time to do it nonetheless. And then before you have kids, for sure, it's the time to do it because life gets a little bit more complex. But I think at the end of the day, breaking this out over months and years, if you can start to actually produce on that right now, maybe think of it like an annuity or something where there's compounded interest on it. Buffett calls, compounded interest like the eighth wonder of the world. So if you can start producing and collecting revenue today, but then pay for something over 12 months or 24 months or whatever the case may be, it's the momentum you gain for the rest of your career is exponential at that point.
And I think you're right. You've made so many good points. It's always patient-centered first, profitability second. But without profitability, it's a very long, difficult career as a practice owner. Your practice might not be able to stay in business. I always use this photo here of my daughter Taher. Have you ever heard someone at a hair salon say, I hope my insurance covers this procedure? And since we're here and I talk about some of the challenges facing dentistry, Taher, be honest with us. There's only thousands of people watching. Prior to doing this, have you ever hidden from a hygiene exam in your life? I have hidden from a hygiene exam. Have you ever hidden from one?
I can't say I've hidden, but I've flat out said, hey, I'm stretched thin.
Yes.
I can't make it. I can't get into the
Well, I
room
work
right.
with multiple dentists, and sometimes I hear Paul, and I say, if I hide, they'll start calling my brother Jeff, maybe. But it's an exhausting life. And I say, what are the factors that cause us to be stressed? EBITDA, new patients. But I would say it's this: reducing the number of times. Let me know if you hear this one, Taher.
Daphne, I'm heading to my dental office for the day. Do you
Yep.
have any advice for me?
Remember, you're a dentist, so keep it crying on the inside.
Good tip.
And the
Daphne,
reason
I'm
why I
heading to my
bring this
dental-
up for everyone watching is it feels like this to be a dentist some days. But when you have the RICs and you're able to transform people's smile, I have yet to get a hug after a class 2 on number 15, Taher. I don't know if I've waited too long. I'm kind of want to just keep reinforcing to this audience. Some are dental students, some are new dentists, some are practice owners. Take away the profitability part, take away the dollars per hour. How does it make you feel as a dentist, right? How does it make you feel as a dentist when you're the person who holds these special power with implants to truly change someone's life forever for the better?
Yeah, I've done a lot of reflecting on that question, and because we're out so many years, it's hard to put ourselves in the place of someone who's, in the beginning of their journey, with student debt and all these things going on, and still making the investment, still figuring out the nuances of these procedures. But there will come a time that, from a financial perspective, all your needs are met, and a lot of your loans are taken care of. You're kind of moving into this next phase of your life. And I think people get there faster by implementation of surgery. But then the dynamic shift that occurs is like, okay, the needs in my life that I thought that were like my absolute needed type of things, okay, that's done. Well, now I get to actually focus and just be in this space of like, hey, I don't have to rush from room to room. I don't have to do procedures I don't want to do. I can say yes and no and charge what I want for certain cases. And I get to actually affect people in the way that I truly want to have that impact with them, and connect with the person in the way I want to connect with them. And I don't think, and again, I'm totally wrong in this statement. I just think it's easier to do it via surgery and all on X's and all of that, because it's such an immediate change versus sticking with traditional dentistry. But I don't know if that answers your question, but it takes
No,
time.
I mean, what you're sharing is you get to, I would put it this way, you get to dentist on your own terms, right? And one of the things I'll share is I had Mark Costas, one of your partners in Philly, and he's unfailingly positive, but in his to start to the Dental Success Summit, this didn't sound positive. What are the 5 factors that are harming dentistry? And one of them had, so would you say, do you think dentistry is a good to great career, Taher? Do you think dentistry has a lot of positives?
I think done well, it's exceptional. And I think if you do some things out of order and maybe miss a step here and there, yeah, it can be, you can feel like you're in a grinder.
I agree with you. I'm a big fan of Gary Vee. And I want to say this. I think it's awesome. And I think stuff like this is a problem.
Oh no, it's the Wicked Witch of dental insurance.
I'm going to reduce all of your fees.
But it costs more to run a practice.
I don't care.
So is that
Super
video, as
believable
funny
laugh.
as that it is, dental insurance is paying dentists less for work that costs more to deliver. It's true. That's a fact. But dental implants, for the time being, at the time of this recording with Dr. Nacho and Dr. Taher Dhoon of the Colorado Surgical Institute, implants are not as affected by insurance as our traditional dental procedures. You're able to, I use the word coupon, use your insurance like a coupon. If you have a $30,000 case, hey, your dental insurance coupon may contribute $2,000, and you're welcome to challenge me, Taher, but most of my patients are not making big picture implant decisions based on their dental insurance. Have you found that to be this similar in your career?
100%. The thing I'll add to that also is if you couple sedation in there, for whatever reason, if you're sedating someone, they make their appointments and they don't cancel. They have no problem prepaying for their appointments because they've now made provisions in their life to like take time off and be sedated. So if you couple in sedation with surgery, yeah, I mean, I do a version of like, there's something called the high-tech law, where it's the patient's ability to waive their own HIPAA privileges to their own insurance company. and we have the forms, but essentially if you're doing like a full arch procedure and you unbundle the codes and you say every extraction is this code, every bone graft is this code, it could come out to $60,000+ sometimes. Well, if you just give them a flat rate for the procedure, then at that point, they're saving money. You can use their benefits towards their hygiene. And a lot of patients are totally fine going a non-insurance based route when it comes to surgery and sedation. So again, yeah, as we sit here today with implants, I just believe like if you don't actually start doing this in your practice, you're just missing the boat because you're not on the bleeding edge of this stuff anymore. It's tried and true. It's in GP practices. I got oral surgeon buddies who I went to school with, and we were in the fraternity together. We lived together. He was a groomsman of mine, and he still stands from his place as an oral surgeon and says, GP should not be doing this stuff, right? He was telling me this when I graduated and all the way up until this moment. And right now, it's like that is not the case anymore. There are generalists doing amazing reconstructive things. There's GPs doing zygomas and crazy surgeries. And here's the thing, it's like now to incorporate wisdom teeth and single implants and verticals and an all-on X that's done in a very safe and professional way. This is what's happening. This is the movement that's occurring in the industry. And I just believe if people don't start the learning process now, because if you take the course now, you're going to be proficient in a year. You're not going to be proficient after one course.
I was interviewing a practice owner. I think he's in his early 30s, mid 30s, and he took a comprehensive, actually restorative course. And I asked him about it. He said, my regret is I didn't take this sooner because I wish I could have gotten the ROI on this earlier in my career. So that's why if you're a D2 watching in on this, you're in the right place. If you're a new dentist, you're in the right place. If you're a practice owner of 10 years, you're in the right place. One of the things that I found magical about implants, Taher, is that general dentists with a foundation of surgical skills have the ability to implement small and medium cases immediately. And then people I've trained have gone on to be people like you, Taher, beyond me. And you just need to figure out what fits for you. Start with small, go to medium, go to large. As I promise you 30 minutes. I'll only take 5 more minutes of your time there, but one value, and I want to give this to you too, told Mark about this. So I have the opportunity to speak a lot. I love doing it, teaching people, sharing. So this How to Speak by Patrick Winston has 15 million YouTube views. I highly recommend anyone who talks to people. So if you're someone watching in on this or listening and you talk to people and you want to get your message across, highly recommend his YouTube video, How to Speak and to Sell is Human by Daniel Pink is one of my most favorite books. Have you read that one or listened to it, Taher?
No, I've heard of it, but I have not. But one thing I'll add to that is I do a lot of coaching calls with people and they're like, well, how do I get case acceptance? And a lot of it is how to talk and how to have a conversation and how to make an instant connection to someone. And you got to kind of cater your personality to their profile. But again, dentists want tactical, actionable things you can do. So what you can do is you can go onto YouTube and you can type in Randy Alvarez dental implants.
Yeah.
He has a show called The Wellness Hour. What Randy will teach is how to connect with someone through television, specifically with dental implants. And so some of the docs who are on there are really good and polished, and some of them aren't so good. But what I'd recommend for everyone is listen to the videos. It'll teach you how to talk about implants in a way to connect to people. And then you can figure out what sounds authentic and genuine to you, and you can curate and take that. And then you can figure out like, oh yeah, that doesn't sound good. And you can leave that out of your vocabulary. So that's something I recommended for a lot of
I love it. I think that's awesome. Giving these little golden nuggets, things that you can listen to on the treadmill in your car, is so great. People can text the word words to 215-543-6454. They'd like any of my team training videos on how to talk about dental insurance. But as we wrap up, to bring us back, to circle back on our idea, the Colorado Surgical Institute, awesome nacho sponsor. People can text CSI to 215-543-6454 to learn about your courses and get a sponsor nacho deal through the awesome generosity of Taher, Dr. Brisky, Chris. Just speak to my audience, Taher. They're watching in, they're listening. Why should they make plans, treatment plan, their dental life to come and see you in 2023 or 2024 to learn wisdom teeth, implants, how to be a more complete dentist?
Yeah, I think if anyone is considering adding this to their practice, or you've already added it to the practice and you're just not implementing it in the way that you thought that you needed to, I would encourage you just to call us. Can I throw my cell out on this thing,
Yeah,
or is that
sure. You're welcome to. Yeah.
all right? Keep in mind, everyone, I'm Mountain Standard Time because I did this
Sure.
before and I got calls at like 4 a.m. So Mountain Standard Time, but my cell is 858-692-3533. What I would recommend, because I do a bunch of coaching calls from a business perspective and I do surgical coaching calls now, just run a couple cases by me. If you got a case, take a picture of it, text it to me. I'm only clinical 2 days a week, and so I do a lot of this other business work other times. And what I would say is, if you're thinking about implementing it, you can't go to any course and implement it. Like, that's just not possible. What we do is you get coaching calls with us for consistent follow-up and mentorship. What we're finding is cases will walk through your door and you'll actually try to do the case and it'll be too difficult, or there'll be a complexity to it that you're not seeing. So we'll tell you, hey, these cases don't do, refer these right now. And then you'll text me a case. I'll say, yeah, you got the green light, go for it. Here's how I would approach it. So it's always good to get confirmation and get coaching on these things. So if you come to a course, you need consistent coaching afterwards. And then we actually invite you back to the same course, 6 months to a year later, at no charge. So you can do the cases in your practice, come back and watch other people do them, and then really, really, really lock in the information. So it's a sincere offer to anyone. If you text me, I'm really good. If you leave a voicemail, I'm kind of good. If you email me, not so good.
People are
So
asking in the chat. Let me just, since I have the, I'm practicing to be a radio DJ, even though no one has radio anymore. But if you would like to contact my friend and nacho sponsor, an amazing educator, Dr. Taher Dhoon, you can do so on his cell phone, 858-692-3533, 858-692-3533. I've also put my own cell and email up here, paul@dentalnachos.com, and my cell 267-896-1942. I'd be thrilled to introduce you to Dr. Taher. I help him along the way as well. I always talk about FIPS, Taher, friends in your phone. Who can you joke around with? Who can you ask for help? And that's kind of what I want to leave us on. Listen, it's great to go to these courses to learn how to change lives. It's great to go to these courses to learn how to be a better dentist. It's great to go to these courses to learn how to be more patient-centered and profitable. But leave us with this there. Are these courses fun? Do people make friends that they connect with after these courses? Do they kind of remember why they went to dental school? I mean, it's not illegal for dentists to have fun, Taher. I imagine with Mark Costas and you and his people, there's maybe some fun doing these courses too.
yeah, and I think one thing is important is culture in the practice is super important, but culture within the CE course is important. Culture within the people you go to the course with is important. And sometimes it can be isolating to say, hey, I'm really into these things, and then not have friends directly in your area who are on the same level of passion and dedication and the want to better themselves in this forum specifically. But when you come to a course, you find people who are like you in that way, who are in the same part of their journey, and you guys can, and that's the thing, a lot of magic happens where in between the breaks and in between the courses and at dinner and everything, you guys swap numbers and you push each other and then you pace with each other. It's like having a buddy at the gym. You're going to lift more if someone's there.
I love that. I just did something with Dr. Kyle Stanley on his mentally resilient dental thing. And he told me something really cool. And for all the things I've done, I've never heard this happening to her. And I imagine it might happen with your courses, but he has this, group that meets after the courses. And he said this group became friends and they eat dinner together on Zoom with each other once a month from all over the world, I think. And I think that's so cool, right? Because you know what? Sometimes your best friend from dental school, they know too much about you. Sometimes your spouse, they're in it with you. Sometimes it's just really nice to have these friendships from CE that you can kind of just have the fun part of the friendship. They're not your dental partner. And I think that that's a really cool, positive consequence of going to CE with people like that.
Yeah, I love the notion of breaking bread with people, even via Zoom. That's really cool. I've kept in touch with people I trained with 10 years ago, but I'm actually going to suggest that idea. That's a beautiful idea.
I'm glad. Well, we're always thinking I'm going to take us off Facebook Live. Nacho Crew, text CSI to 215-543-6454 to learn about an awesome implant training course and other courses with our sponsor, the Colorado Surgical Institute. Taher, stick around for 1 second. Just going to take us off here. Perfect. There's some people on Zoom. Awesome, Taher. Sorry I kept you a little long, but I was really enjoying that conversation.
Totally good, man.
And
Totally good.
there's a couple people listening on Zoom. Maybe tell me if you don't mind for this November course. It's 3 days. It's advanced. What is the investment? What's the cost? So in case
So if
people
you
ask
do-
me.
Yeah, if you do singles, and this is without the nacho discount, so keep in mind that this is UCR, right?
Yeah,
My
we got a
cat-
20% discount code.
Oh, cool. Yeah, dude, 20% is really good. So I think it's 12 grand if you do singles or wisdom teeth or something in that forum. And then if you get into laterals or the arch, you're in the like $16,000 range. And so if you do 20% off, then whatever the
That's a
math
great
is.
deal.
right?
Please, I know you got a million things going on just like me, but and I know what this matters to you. You're welcome to, share photos on the group, share testimonials. It just takes that. We got 52,000 people in Nachos. It just takes
that's
that one
awesome.
magical one or two that we can help. Maybe they're here on this Zoom watching in, but I'm really honored to be part of what you're doing and excited to keep doing it with you.
Yeah, well, hey, definitely appreciate the support on that end.
Awesome, Darryl. I hope to see you in person soon. Thanks for jumping on. Go back to your family. Enjoy the rest of your night.
All right, man, take care.
Thanks.